Imagine walking to the mailbox and feeling your knees wobble. You smile and say you walk every day, but inside you wonder if that will be enough next year. I used to think a daily stroll was the secret to staying independent, but a surgeon friend told me a truth many people discover too late, after about 65. Walking alone often isn't enough to keep your legs strong, your bones dense, or your balance steady. Stay with me, because in the next few minutes I'm going to show you the simple exercise approach surgeons and geriatric experts trust the most. Why walking starts failing many people after 65 and exactly how you can start strengthening your body safely at home today. You might be thinking that you walk 30 minutes a day, 5 times a week, and that should be enough. Walking is wonderful for the heart, mood, and overall health. But even the World Health Organization emphasizes that for older adults. Muscle strengthening and balance work are just as important as aerobic exercise because walking alone doesn't stop the slow loss of muscle, the drop in power, or the balance changes that increase fall risk as we age. Let me explain simply. Muscle mass and strength naturally decline with age, a process called sarcopenia. Endurance and strength are not the same. Walking builds endurance, but strength training builds the force your legs need to rise from a chair, climb stairs, carry groceries, and catch yourself if you trip. Research shows that resistance training can significantly improve strength, daily functioning, quality of life in older adults, and the improvements happen surprisingly fast. A simple example is Mrs. Khan, a 72-year-old who walked every morning. She felt healthy, but she started noticing slower steps on stairs and trouble standing up from low chairs. After just 8 weeks of gentle strength training twice a week, she could stand up without using her hands and carry a grocery bag up the stairs without stopping. This is exactly what the research shows. Strength training improves the practical movements that matter most, not just how far you can walk. This happens because muscle fibers and nerve signaling change with age, and strength training teaches your nervous system to recruit muscle fibers more efficiently. It also helps bone and tendons stay stimulated through load and resistance, something plain walking often doesn't do strongly enough. That combination can reduce fall risk and fractures over time. Some seniors worry about safety, but studies repeatedly show that progressive resistance training is safe for older adults when done correctly. Start light, learn proper form, and progress slowly. If you have heart problems, uncontrolled blood pressure, severe osteoporosis, or recent surgery, check with your doctor first. But for most seniors, especially when supervised or guided, the benefits far outweigh the risks. The one exercise the surgeon mentioned isn't a single move, it's a simple program built around progressive resistance training for the major lower body muscles, combined with short balance practice. In plain English, it means doing simple leg strengthening exercises twice a week and adding a few minutes of balance work on alternate days. You don't need a gym or heavy equipment. A sturdy chair, resistance bands, light dumbbells, or even just body weight is enough. A research-backed home routine includes 2 strength sessions a week, each about 30 to 40 minutes plus 2 or 3 short balance sessions. Strength sessions focus on 4 key moves: sit, 2 stand, hip hinge, or band deadlift, step-ups, and calf raises. These target the main muscles you use every day to stand, climb, and recover from stumbles. Studies show these kinds of exercises improve walking speed, balance, and everyday function. Start with a 5-minute warm-up like marching in place. Then do 2 to 3 sets of 8 to 12 repetitions for each exercise, resting between sets. If 12 reps feel too hard, start with 6. The goal is progressive overloads, slowly adding resistance, repetitions, or control over time. Sit a stand is simple. Sit back in a sturdy chair, lean forward slightly and stand up without pushing with your hands if you can, then sit down slowly. The hip hinge uses a band or light weight. Push your hips back with a soft bend in the knees and then stand tall by squeezing your glutes. Step-ups use a low, stable step and mimic stair climbing, while calf raises strengthen the lower leg to help with balance and recovery. After strength work, finish with a few minutes of balance practice. You can try tandem stance, 1 foot in front of the other, or a supported single-leg stand while holding a chair. These simple drills improve stability and reduce fall risk. Keep walking for heart health and mood, but replace one longer walk each week with a strength session or add strength work after your walk. The strongest results come from mixing aerobic walking with strength and balance work. Track your progress. In everyday ways, if you can stand up from a chair without your hands, climb stairs more easily, or carry groceries with less strain, you're getting stronger. Increase resistance or repetitions every few weeks. Stay safe by warming up, breathing normally, and stopping if you feel pain, dizziness, or chest discomfort. Check with your doctor if you have major health concerns or very low bone density. A physiotherapist can help you learn movements safely if you're unsure. 2 strength sessions per week plus short balance sessions make a huge difference in only weeks, and you can adapt this to your lifestyle, even while traveling. The evidence is clear. Progressive resistance training improves strength, reduces fall risk, and boosts independence for adults in their 60s, 70s, 80s, and beyond. A 12-week plan might start with learning movements in weeks 1 and 2, increasing sets and reps in weeks 3 to 6, and adding gradual progression in weeks 7 to 12. Many seniors see measurable strength improvements by week 6. Real stories show this clearly. Mr. Ahmed, 78, thought he was losing his garden forever due to weakness, but twice-weekly band workouts reduced knee pain and improved balance. Mrs. Lee, 69, regained stair confidence after 2 months of step-ups and hip hinges. These are the kinds of changes that keep independence alive. If you take away one message, let it be this: walking keeps your heart healthy, but strength and balance training keep your body capable. Make strength training as routine as your daily walk. If you don't know where to start, use the simplest beginning possible. Do 1 set of 8 sit-to stands and hold a 10-second single-leg stand near a chair. That tiny start builds momentum. Thank you for listening. If you want more simple routines, gentle follow-along videos, or printable plans designed for seniors, just let me know. Your health after 60 matters, and I'm here to help you stay strong, steady, and independent. Subscribe for healthier aging, and share this with someone who needs encouragement. This video is for informational purposes only and is not medical advice. Always consult your doctor before making changes to your diet, exercise routine, or medications.